Can you tell me about a time where you recognised adverse changes in your patient's condition and how you responded?
So at the beginning of each shift, I do a full assessment of my patients, beginning with Dr. ABCDE, head to toe assessment, respiratory assessment, cardiac assessment, GIT assessment, and a neurovascular assessment. When I came onto the ward to do my beginning of shift after handover, I did my assessments on my 4 patients that I was looking after for the day. When I'd finished my assessments, I began medication rounds. When I had gotten to my 3rd patient, I went in and asked him to do his name, his date of birth, and any allergies. And I'd noticed that he was slurring his words a little bit when he gave me his name, which in my initial neurovascular assessment, he wasn't doing. So I alerted the team leader that this was happening. We went down there, conducted a thorough neurovascular assessment, and came to the conclusion that he was having a TIA. From this, we alerted the emergency team. They came down and took him off to surgery to reassess him.
What is work health and safety, and can you give me an example of your application of work health and safety in clinical practice?
Work health and safety is something that is everyone's responsibility, from the very bottom to the very top of staffing. It is policies and procedures that are there to keep everyone safe and out of harm's way. A incident that I had was one where one of the patients had spilt their drink all down the side of their bed, and people were coming in and out of the room, and I identified that there was a spillage. I alerted someone to call the cleanup team to bring in some stuff to clean up the drink. I assured that I stayed with the spillage the whole time. I did not move. I did not let anyone come near it, and I ensured that it was cleaned up quickly and thoroughly.
You have a Muslim woman going to theatre for a D&C post trimester delivery for retained products of conception. As you prepare her for theatre, she refuses to take off her hijab. How do you manage this?
Okay, so first thing, I would ensure that I am culturally safe when dealing with diverse culture patients, ensuring that I know as much as I can about their culture and things and ways that they have things done, and things that might culturally offend them, to ensure that I don't cross those lines. The first thing I would do would check with hospital policies and procedures to ensure that her wearing her hijab into surgery was acceptable. I would also educate the patient on infection control, if she had a clean hijab that maybe she could put on, or something like that. I would also suggest if really insisted on wearing her hijab and it was against hospital procedures, I would offer something like an extra gown or something that she could use as a hijab, a surgical gown, that she could use as a hijab. I would ensure her absolute privacy while changing over her hijabs, and just ensure that I was remaining culturally safe for me and the patient.
You have a 12-year-old Aboriginal girl from a remote community on the ward with query appendicitis. The RMO advises that he thinks her appendix has ruptured and that she will need to go to theatre ASAP. Her mother has gone uptown to do Centrelink banking and shopping. How do you manage this situation?
First things first, I would attempt to contact the mother. Hopefully she has a mobile phone on her. If she hasn't, I would check with hospital policy and procedures and a senior RN if the surgery can go ahead because it is an emergency situation. If I could contact the mother and explain the situation with her, I would get her verbal consent. I would also have her repeat it to another RN or the RMO, just to make sure that there was more than one person listening when she gave verbal consent.
The border mother of a 6-month-old admitted to the ward with pneumonia returns to the ward after an evening off the ward. She appears to be intoxicated as she has an atastic gait and smell of alcohol. She picks up her son and starts breastfeeding him. When you approach, she asks for some sandwiches to eat, and as she has not had any dinner, how do you manage this situation?
Firstly, I would remain culturally safe, ensuring that I am not going to be seen as attacking the mother. I would certainly grab her some sandwiches from wherever I could for her to eat. I would also educate her on the effects of breastfeeding and alcohol use, just in conversation. I don't want to be seen as for her to feel like she's being attacked. I would ensure that she has some fluids to drink as well, and that someone remained with her and the child to ensure that she didn't put the child's safety in danger. Thank you.